Hi, welcome to Represent NYC. I'm Assemblymember Richard Gottfried, and I represent the neighborhoods of Chelsea, Hell's Kitchen, Midtown, Murray Hill, part of the Upper West Side, and I chair the Health Committee in the New York State Assembly. For the last many years, I've been working to get a law passed in New York to allow the medical use of marijuana. And for the last couple of years, the Senate sponsor of the bill, Senator Diane Savino from Staten Island, she and I have been really regularly pestering Governor Cuomo's administration to try to get them to come to the table and work with us on the legislation to help shape it and get it passed. During that time, we were working on lining up more and more support in the Assembly and the State Senate. And by early June, it was looking pretty good that we would be able to get a bill passed in both houses of the legislature and send it to the governor's desk, where he would have to decide whether to sign it or veto it. And at that point, a couple of weeks ago, somewhat to our surprise, we got a phone call from the governor's office saying, well, they did want to meet with us and talk about some changes in the bill that they thought were needed to be made. We worked with them, and the bill passed both houses with the governor's support. And depending on what day you're watching this program, the governor has either just signed it or will be signing it in a day or two. Here today to talk about the legislation and how it got enacted is Gabriel Saya, who is the New York State Director of a national organization called the Drug Policy Alliance. And for the last several years, the Drug Policy Alliance and Gabriel have been really leading the activism in New York, the advocacy to get this bill enacted. Gabriel, thanks for joining us.
Thanks for having me on, Assemblyman.
You know, people often think of Albany as a place where powerful special interests come together and people who can make big campaign contributions, pull strings and get legislation shaped and enacted. My sense is that if any of that was going on this issue, it escaped my attention. And what was really going on here, I'm tempted to call it a grassroots effort, but we've had enough marijuana puns on this topic. It has really been an effort coming out of rank and file citizens over the last several years.
Yeah, it's a remarkable story. I mean, you've carried the bill since 1997, so the issue has been under consideration in Albany for a long time. But it's been in the last 2 or 3 years that we've seen a real groundswell of support on the part of everyday New Yorkers, people living with cancer, multiple sclerosis, families who are caring for children with epilepsy, people with HIV and AIDS from around the state who gathered together and collaborated to get this bill passed. It's really an incredible story. We've been working on this for some time now, and our role as the anchor organization for a statewide coalition was really a facilitative leadership role. But the real boots on the ground, so to speak, were everyday New Yorkers and the people who wanted to have access to marijuana as medicine under the supervision of their healthcare provider. And from Buffalo all the way out to Long Island and all parts in between, we saw folks who had never even spoken to an elected official before all of a sudden become experts in the legislative process and they spend a lot of time in Albany, as you know, working to get this bill passed. And fortunately, last week that finally happened. Yeah,
for the first many years of the effort, you know, the people speaking out for the bill were activists of one kind or another, a handful of physicians, nurses, healthcare professional organizations. It's really only been in the last several years that this really amazing army of patients and family members came together. How did you pull that together?
A lot of it was by real basic organizing, real basic community organizing. We had a remarkable field team, Julie Netherland, Alexis Posey, Anna Saini, who were all working in the field, and they met with folks around the state. A lot of cold calls were made to organizations like breast cancer coalitions or groups working on multiple sclerosis. A lot of cold calls to patients who had expressed interest online or who we were introduced to through other contacts. And it was about sitting down with people. I mean, we traveled all over the state extensively and repeatedly to meet with people in their homes, in their churches, in their community organization headquarters and so forth. And really just explain to people what we were doing and hearing questions that people had and what they wanted. And it was through that process that folks began to sign up and get on board. And so you have folks like Wendy Conti in Buffalo, a mom, her daughter's Anna, who has a severe epilepsy and has these severe seizures. And Wendy said, look, I've never organized anything. I'm not an organizer. And yet she turned Buffalo on its head. You have people like Missy Miller down in Atlantic Beach, Long Island. She lives in Senator Skelos' district. She's a fierce advocate for her son Oliver. You had folks like Susan Rusinko and Donna Romano out of Syracuse, who were part of MS Resources of Central New York. And they just about flipped Central New York on its head, especially with Senator John DeFrancisco. I mean, they were showing up at the mall and at church and community events to talk with him. So this was a really significant process by which New Yorkers who said, look, this is something that could benefit me. And many of these folks had already spoken with their physician who had told them, if marijuana was available, I would recommend it for your use or the use of your child. And they couldn't have access to it because we didn't have a law here. Meanwhile, in New Jersey or Connecticut or places all across the Northeast in the country, laws are in place where doctors could recommend this. And so they got engaged and got active. And we ended up with thousands of patients who were part of the coalition, people who took action, some people who were bedridden and couldn't ever leave their home but could make phone calls to the governor's office, to the Senate. And we even had there was one patient who is literally on her deathbed who wanted to share an op-ed in the final hours of the legislative session saying, let me die with dignity. And that got published widely on the internet. So folks really took their personal stories and made them the front and center for a discussion about what needed to happen here in New York so that we could have some semblance of compassion for people who needed it.
For me, one of the most compelling witnesses at our hearings was the mother from New Jersey who came to our Long Island hearing, whose daughter, I think, was 2 years old, had died a little over 2 weeks before the hearing in New Jersey while on a waiting list for approval to use medical marijuana to treat her daughter's epileptic seizures. How she found the strength at that time in her life to come to New York and speak at a public hearing is just amazing. And you know, at both the hearing on Long Island and the one in Buffalo, there were points in the testimony where I wasn't sure I could continue holding the hearing. It was, you know, seeing the parents of these young children and people who, you know, who are eager to be able to get up in the morning and go to work, but can't because of their neuropathy and other conditions. And I gather from the reports that you kept bringing back to us that they were very effective in their one-on-one meetings with legislators around the state.
Yeah, they were. I got to tell you, we met with nearly everyone in the Senate and a lot of your colleagues in the Assembly, as well as with nearly everyone in the governor's administration who would take a meeting with us, aside from the governor himself, who didn't. And we brought them binders full of all the evidence about the medical use of marijuana, the research that had been conducted, the comparisons with other states, you know, the legal memos about what the federal law said states could and couldn't do. All the evidence was there to do this, and that evidence has been around a long time. And for some people that was sufficient, but for many it wasn't. And what tended to have a larger impact were the personal stories that people told. Sharing how marijuana helped alleviate their spasticity for their MS. The stories of children who were out in Colorado using variations of these marijuana-based tinctures that were reducing or stopping entirely some of the seizures that they had. These stories really were both moving, but also quite powerful, and I think gave many of the elected officials in Albany an idea about what we were really talking about here, that this was about medical access, it was about alleviating pain and suffering, and making sure that people could have access to something that if it could benefit them, particularly for those who were looking at end-of-life issues or for children who might otherwise, many of these children die as a result of the conditions that they have. It could reduce or even stop some of the seizures and allow some of these children to live a semblance of a normal life. We needed to move quickly to make sure that they had access to that. And I think that those stories had a really big impact on many of the elected officials. And we saw it. I mean, you heard Senator Skelos's comments at the end of session on the floor. He was one of the biggest opponents this entire time. And to see his transition.
This is Senator Skelos, who's the Republican leader in the Senate.
That's right. And he was the target of a lot of our advocacy. He was the one who had the power to let the bill onto the floor and had never proved that. And his sharing his own process of transformation, having heard the stories and met with many of the patients, including the Miller family in particular, that transformation on his part, I think, was indicative of something that happened with many officials, where they, all of the politics that shape and surround this issue, unfortunately, tended to melt away to some extent. So that we could get down to the core of what it was really about, which is people and compassion and really trying to alleviate suffering.
Yeah, to me it's been fascinating that, in New York in 1977, we were one of the first states to decriminalize possession of small amounts of marijuana. So for recreational use, our law for 37 years has been one of the most relaxed and tolerant in the country. And in all those 37 years, I don't think anyone has ever suggested that we should undo that law or that we should go back to having tougher laws on recreational use. And certainly anybody who wants marijuana for recreational use in New York can buy it on probably any street corner, and the criminal penalty is the equivalent of the penalty for littering. And yet, there was this passionate belief we kept bumping into in legislators and others that somehow people are gonna use this law to get recreational, to use marijuana for recreational purposes. And I've always explained to people, in order to use the medical marijuana law for recreational purposes, instead of committing a violation like littering, you're going to commit a misdemeanor. You can go to jail for a year. You've got to find a doctor willing to risk his or her license and liberty to sign on the dotted line for you. The doctor's certification has to be filed with the state. You've got to send the state your name and address and a picture and carry an ID card, all to get a substance that you can buy on any street corner at almost no legal peril. It has never made any sense to me that that the politics has been so convoluted on this issue, but nevertheless, it certainly is, or has been.
Yeah, I mean that kind of convoluted politics is certainly the reason why we even need to have a statewide medical marijuana system. I mean, had the federal government not so completely committed itself to this war on drugs ideology, preventing the research into marijuana, keeping it as a Schedule I drug, which means it has no medical value despite the ample evidence that it certainly does. That's all based on a political framework of the war on drugs, which thankfully is increasingly falling out of favor, although is still, I think, a structure in place in many respects. If we didn't have that in Washington, we wouldn't have to take action as a state, and that's why 22, now 23 states have moved forward, saying, look, we're not going to wait for D.C. to take action to alleviate the suffering of our residents in our particular state, California being the first one out the gate in 1996. We've got to continue to make changes that are sensible, and the states are likely to be the place where that happens for the foreseeable future. Washington is not, I mean, as bad as Albany is, it's perhaps a little better than Washington, D.C. is. And D.C. does not seem poised at this stage to move forward in making any substantial changes. But you're right that our marijuana policies in general in New York haven't made much sense. Aside from the the lack of access for patients, as you know, that will hopefully alleviate some of that through this law. There's also been all these arrests that are happening for marijuana possession, even though it's decriminalized. And we've got these debates that happen in Albany where quite frequently, too often, there's to be polite about it, the degree of misinformation and ideology that shapes the debate, unfortunately, undermines the ability for us to pursue sensible policies that both enhance public health and public safety, which is why I think this medical marijuana law, as limited as it is in some respect, is really a breakthrough and a tremendous one, and one that's nearly 20 years in the making here in the state.
Let's talk a little about how the law is going to work. Who will be able to use marijuana for medical purposes? How will they go about getting it?
There's a list of conditions. As you know, in the initial legislation that you put forward, the idea was to allow physicians to make a determination, as they do with every other drug, as to whether or not a patient may benefit from the use of marijuana. But under the final bill that was passed, it's a list of about a dozen conditions. It includes cancer, multiple sclerosis, epilepsy. So if a patient has that condition, their physician can recommend the use of marijuana. The physician has to be registered with the state. The patient will have to then register with the state. And then they'll be, once they are approved, they'll be allowed to go to there'll be approximately 20 dispensaries. That's the limit right now under the law. That will hopefully be placed in geographic diverse places across the state. They'll be able to go to one of those dispensaries to purchase the marijuana for medical use. That marijuana will be produced by one of 5 organizations called registered organizations in the bill. And so the governor's saying it's going to take 18 months for them to get this up and running. And we're hoping that it will happen a little bit sooner than that, given that some of the needs of patients are immediate.
You know, the limit of 20 outlets is, I think, a really unfortunate restriction that the governor insisted on. I mean, from where we're sitting today, within a few blocks, there are probably at least 20 dispensaries where you can buy morphine and hydrocodone and Valium. You know, they're called pharmacies. The notion that a state of 19 million people is going to be served by 20 dispensaries, I think, is something that's going to have to be fixed in the legislation. Tell me a little about the time frame of implementation is going to mean to some patients.
Yeah, we know from other states that it does take a while to get these systems up and running. You've got to, they've got to craft a regulatory system. They've got to license organizations. They've got to create the cards. They have to get that up and running. And so fairly, it'll take a minute. But there are some patients that don't have any time. I just yesterday spoke with Missy Miller, and her son Oliver is really facing a very serious life and death circumstance here. They need to have access to this medicine to see if it can alleviate some of Oliver's seizures. There is an opportunity that the governor can take here. He has the authority. He wanted all the authority. He got it. The governor can now exercise that authority to expedite access for those patients that need it. So while it's going to take a little while to get the entire system up and running, so presumably based on the governor's statements, by the end of 2015, there'll be a system up and running in the state of New York. But for those patients that can't wait until the end of 2015, there needs to be something that happens now. And there's a couple different ways to do that, but it's going to require executive action, and we're hoping that that's going to take place soon.
Certainly in states like Colorado, which probably has, I think, the most developed and tightly regulated production and dispensing system, I would think it ought to be possible, if the governor wants to make it happen, to reach out to one of the companies in Colorado and help them set up an operation in New York almost immediately, particularly for the very young children with seizure disorders, to make the oil extracts that they use available. In the version of the bill just before it passed, we would have allowed a patient to go to another state like Colorado to obtain their medical marijuana and bring it back to New York. The governor insisted that we take that out, but hopefully we can figure out with the health department and the governor a way to bring one of the out-of-state operations into New York, even on a limited basis, for patients who have, really life-threatening conditions.
Yeah. And the other thing that could happen, as far-fetched as it may seem, is that the Obama administration, the Justice Department, could supply a waiver and allow patients from New York to go to a place like Colorado, Colorado that has a recreational system up and running, that doesn't have many of the same restrictions that the medical system there does, to obtain some of the marijuana through the recreational system and then transport it back to New York without fear of criminal sanction when they're crossing state lines.
Yeah, fortunately, people often ask, New York State can pass this law, but isn't it still illegal at the federal level? Fortunately, the U.S. Justice Department, which is in charge of federal drug law enforcement, has made it very clear. They've put out a fairly detailed paper saying that basically they are not going to interfere with people who are acting in accordance with tightly regulated state legislation, which I think it's pretty clear New York qualifies for.
What's amazing is that just last week or the week before, the U.S. House of Representatives, the Republican-controlled House of Representatives, passed a bipartisan measure that directs the Justice Department essentially to stay out of the way of the states. It tells the DEA, stop raiding states or being, prosecuting people in states where what they're doing is following state law. This is a huge development. There's some expectation that a similar measure will pass in the Senate, where it was introduced recently by Rand Paul, a Republican from Kentucky, and Cory Booker, a Democrat from New Jersey. That kind of bipartisan consensus that's emerging in D.C. right now, which is about something very basic, which is, hey, federal government, stay out of the way of the states. If they've enacted a state law, you shouldn't be interfering with them. I think that's a really good development, and one that may lead to a more robust debate in D.C. about the broader problems of our marijuana policies right now. So it's a very interesting time, and one I think is potentially quite hopeful that, in terms of getting access for patients who really need it, particularly those that need it immediately.
Even though the governor's role in the legislation was to make it narrower and more restrictive, I would think if he were to choose to, just as he was a national leader on the marriage issue, he could be a real national leader on sensible policies on medical marijuana.
That's right, and we think that if the governor, when he eventually meets with some of the patients, which we hope he'll do, he didn't do so, at least none from our coalition, which is the largest in the state. During this fight, we asked repeatedly for those meetings. We never got one. We think that if the governor sat down with some of these families or some of the patients, I don't think he would waste any time in trying to do everything in his power to make sure that some of these patients had access to the medicine that they needed. The governor led on other drug policy issues. I mean, this governor was calling for the repeal of the Rockefeller drug laws, before he was Attorney General. He's signed an overdose prevention bill that you sponsored, actually, the Good Samaritan law, that was one of the leading such measures in the country. He's done some really good things on drug policy. And in as much as we had a real fight and disagreement with him on some of the medical marijuana issues, he did turn around on this. I mean, when we started the year on January 1, he was opposed. And there was a real evolution there over the course of the year. And he said, even in the press conference announcing the deal that you all came to, that his stance on this could continue to evolve. And so I think we're hopeful, that his getting behind this, as limited as this current bill is, that it's a sign that he may actually take this on. I think you're right. He could become a leader. And that leadership certainly is missing in the country right now on this stuff.
One of the restrictions in the bill that a lot of people have focused on, although I'm not sure it's the most restrictive of the things we had to agree to, is the provision that says you can't smoke medical marijuana. Without getting into why some people are so fixated on prohibiting that. What does that mean to patients, and will the vaporizing equipment that's now available fill that gap?
Yeah, this was a big issue, and for us it was never about smoking per se. It was always about maintaining the integrity of the doctor-patient relationship. A brief example, Susan Racinko, MS patient from Syracuse, has talked very publicly about her own marijuana use. She tried every single drug her doctors prescribed for her MS. Once she had tried everything, and she was still having a lot of spasticity problems. Her muscles would seize up, she couldn't move, she couldn't cook for her family. She told her doctor, after consulting with other physicians and patients, she was going to try marijuana. Working with her doctor, she found a system that worked for her. She smokes marijuana twice a day, and then at night she vaporizes the raw plant material. Yeah. Now for Susan, that's what works, and what ultimately the smoking issue came down to making sure that patients like Susan, who had tried consuming marijuana, who had vaporized it, she found that smoking worked the best for her. We want to make sure that she could make that decision with her physician. You can get most of the same impact by vaporizing the raw plant material. Our hope is that the governor will allow people access to that. That's important. What's less clear is if you can get the same impact from vaporizing some of the concentrates or oils. They're not as well studied. The raw plant is actually, there's a lot we know about it. We know less about the concentrates and oils. Our hope is that people will have access to the raw plant material. That's not explicitly precluded or excluded in the bill, rather. Smoking is, but we're hoping that patients will still be able to find a route of administration that works best for them, including access to the raw plant material. Vertical integration can work. We've seen it work in places like Colorado, and non-vertical integration can work. The previous versions of the bill included the option, and this was a thing that you had fought for, to not have required vertical integration, but to allow it if companies wanted to do that. You take, for instance, like a beer producer. We have a lot of craft breweries here now in New York. There are hop farmers. Farmers that grow hops in upstate New York. They may not produce the beer, but they deliver the hops and sell them to the beer producers. Okay. We wanted that to happen.
We're going to have to wrap up. Thank you, Gabriel.
Thank you.
For being on and for the amazing work that you and the folks you've worked with did on this issue. Thank you for watching Represent NYC. I'm Assembly Member Dick Gottfried. I represent Chelsea, Hell's Kitchen, Midtown, Murray Hill, and some of the Upper West Side. My district office is at 242 West 27th Street. You can call us at 212-807-7900. You can go to the State Assembly's website and also my individual website at dickgottfried.org. I want to thank Manhattan Neighborhood Network for bringing this program to you, and certainly thank you for watching.